Say this 4 or 5 times. I tell everybody to remember the real McCoy.
Okay. Thank you so much.
I can tell when I,
This is great.
I can tell when I'm getting older. I put a call on me. Sorry.
Okay.
I can tell when I'm getting older. I was on the phone with someone and I said, you know, in the evening, I said, goodbye, I'm Greg McCoy, remember the real McCoy. And it was a receptionist and it was dead silent. And I realized that she was so young, she had never
Heard of the real McCoy.
At that point, I said, oh my God, how old am I?
Well, I'm young and I remember that show.
Oh, yeah. Thank you all for the opportunity to come and talk to you. We're going to go and talk a little bit about our favorite topic, which is Medicare. Okay, not really, but
Social Security.
Social Security, big one too. So, talking about Medicare. Medicare is probably the first time in most Americans' lives where there's a level playing field. So, in America, everything's decided by money. We know that.
Yeah.
When it comes to Medicare, majority of people are equal. And here's what I mean. The 1% in America can write a check for $100,000 and buy a doctor. They're going to get better health care, but they're only one person out of 100. The other 99% use Medicare to pay their providers. And Medicare, it doesn't matter a person making $20,000 a year, $50,000 a year, $500,000 a year, when they use Medicare and they go get a gallbladder operation, the surgeon is getting paid the same, which means that they will, on average, give you the same level of care. Now, this being the DMV, one of the major advantages here is that there's just no dirt, there's no shortage of board certified medical providers.
Yeah.
Now, if you're in Arkansas, you'd have to get the doctor you got. And the nearest facility might be 75 miles from you. And just so you understand, all the things that President Taco is doing, it's going to hurt them much worse than it's going to hurt you. Because of the mass of people here, even if they close the facility, you only have to go 3 miles down the road.
Yes.
But if you live in Arkansas, Missouri, Mississippi, Montana, and they close the federal health building near you, which is 30 miles from you, the next one is now 70 miles. And that's assuming you have a car. And I know I'm not supposed to say this as a Christian, but maybe they need to feel a little bit of the pain so they can understand what's going on in America.
Yes.
But that's another story. I want to talk to you about Medicare today. The plan, Medicare covers 65 million people. That's a lot of people. So if there's 1% of that 65 million, and that is 650,000 people, that's a small city. If that group has some special circumstance, 1%, that's 650,000 people that they've now got to make an exception for. Medicare is difficult because it's 65 million people, and everything about it is just magnified. But when you melt it right down, it is just health insurance. And here's how we know it works. Anybody who's heard this story, raise your hand. Mama and them died because Medicare didn't pay the bill.
Yes.
You've heard that story? I've never heard that.
Yeah, well, it's true.
Really?
Yeah, I'm 81, maybe I'm a little bit older.
A little bit. You heard that? See, usually Medicare pays the bills. They may pay too many, but we really don't hear about somebody not dying because Medicare didn't approve that procedure. Or Medicare didn't pay that bill.
Right.
Some people will say they pay too much. That's another story, but they do provide overall good health care.
Right.
And what we have to do is make sure that we take advantage of that, because ultimately it falls down to us. Now, the drug part of Medicare has gotten better over the last couple of years. Overall prices have gone down some and they capped the amount of money that you can pay out of pocket. So as of last year, the most anybody could pay out of pocket was $2,000, which is a lot of money.
Yes.
But prior to that time, people who were real sick or had the real esoteric experimental drugs that were just coming on board, the drugs that you see advertised on television, oh, they were spending several $1,000s a year on drugs. Now nobody can pay. Well, yeah, last year was $2,000. This year is $2,100. And what they've done is to say, we'll give you layaway, which I just find hilarious. But if I know that my bill, my medical, my prescription drug expenses are gonna go above $2,100, we'll just divide $2,100 by 12 months and that's what I'll pay. Which, when you've got a $600, $800 drug deductible is a real good move because you don't have to come up with $600 the first of the year to then start your medication. But the government give it and the government take it away.
Of course.
So,
Especially this.
yeah. So the drug benefit means that the insurance companies took a hit on that. So the overall benefits, the extras that they give you have been culled down, have been cut down. So Medicare basically covers everything that happens to us in the hospital, that's part A. And part B is everything that happens outside the hospital. I mean, to make it easy. The doctor's visits, the lab tests, the MRI, surgical operations, the stuff that happens on the operating table while you're in the hospital. That's part A. Part B, we have because we pay about $194, which is gonna go up to $205. So if you thought you got a raise, they get $89 of that raise back from you.
They give and they take.
They take. Okay, yeah, I know one. This booklet I gave you is a nice, easy way to understand how Medicare impacts you. And always think of it this way. The only thing you're really interested in when it comes to Medicare is how it impacts you. Think of it as it's just health insurance. Now, it's health insurance for a lot of people, but it's just health insurance. So I tell people that what I want to know is my doctor in the plan? Is the hospital I want to go to in the plan?
Yep.
Does it cover my drugs? And how much is it gonna cost? If I take care of those 4 things, I'm good. Everything else is kind of like what happens behind the curtain. So for you, individually, the things that are most important to you is to know, does my doctor accept this? Is the hospital that I want to go to in the plan? Does it have my prescription drugs? And how much does it cost? Because Medicare, for us, is a math problem. Because Medicare provides a base level of protection for all of us. Now you want to figure out, okay, what's the least amount of money that I can spend? So what I'm going to spend a moment talking about is the math part of it. Spending as little money for quality care as you can. In the DMV, a lot of people have worked for the government, have worked at the state, federal, local level. Or they've worked for some major company and they've retired. When they start out, they retired and they've taken the health plan from the company or the municipality. Well, let's say the health plan started out at $100 a month. And for $100 a month, you got a pretty good plan. They took care of your hospitals, your doctors, maybe a dental, vision, and your drugs. $100 a month, took it out your pension, okay. But every year, they're gonna raise it. Every year. Their overall goal, and they don't say this, but the real goal is to raise it high enough that you will drop out. And you'll go on Medicare. But people don't think that. It started out at $100, Now they've been retired 10 years, now it's $325.
Oh,
But they think that's the only game in town, so they stay with it. Until it gets to a point, 1 year, it just goes up just to a point where they can't go, stay with it. And then they call somebody. You don't have to spend a lot of money for quality health care in the DMV. You don't. And you will not miss a beat. There's red, white, and blue card. We all know we get that. So it takes care of health care. The only other thing we actually surely need is a drug plan. So you got Medicare, you're gonna pay $205 a month, starting next January. And the drug plan might cost you $20. That's your health insurance cover. Now, some people will pick up what they call a supplement plan. And a supplement plan does exactly what it implies. It supplements Medicare, because Medicare provides good coverage, but it does have some holes in it. Deductibles, co-pays. We pay the first $1,600 of a hospital bill, and then it pays everything else. And we all know nobody gets out of a hospital with a $3,000 bill. You sit a day in the hospital, you're at least 25, 30 grand. Don't spend a couple of days there. But Medicare picks up that whole number. It picks up so much of the number that most times the hospitals forget to bill you for your $1,600 piece, which is incredible when they're for it. But people will pick up a supplement plan when they can afford to pick it up, because a supplement plan is going to be a little bit more expensive, in the $150 range. Then there's a Medicare Advantage plan, which I'm going to suspect most of us are on here. I'm on one. The Medicare Advantage plan is underwritten by Medicare. So Medicare pays United Healthcare, Aetna, Blue Cross Blue Shield, Kaiser. It pays them a certain amount of money to manage your health care. So if you have Blue Cross Blue Shield has made an agreement with Medicare that says, okay, Medicare, everything that you would have done for her, I now have to do. In exchange for that, you're gonna give me X number of dollars every month, whether she uses the service or not. They're just gonna figure out what the average number is, and that's just what they're gonna get.
Right.
Now that leaves you with some, what they will call some manageable copays. $0, zero copay for primary, maybe $25 to $40 for a specialist. Hospital, you might pay a couple $100 for the first 5 days, and they pick up everything above that. The numbers are managed. Now, the offset is you probably have to use the guys, the providers in their network. But they've got enough Medicare Advantage plans, and more than likely, we'll find one that has your guy, your gal in it. Medicare Advantage plans take care of your Part A hospital, Part B doctors, and your drugs.
Like I have United Dual Complete.
Come to that in a minute. That's gonna be my grand finale. Now, people who have just Medicare and take a Medicare Advantage plan get Part A hospital, Part B doctors, Part D drugs. The Medicare Advantage plans have to offer you something extra to interest you to move from Medicare to Aetna. So they'll offer you some extra benefits that Medicare doesn't offer. They'll tell you, okay, you know what, we're gonna give you $150 source glasses. We'll give you a gym membership. We'll give you $40 every 3 months for over the counter stuff. And at some point you say, okay, I'll try you guys. Now they're cutting back from that, but they give us some level of extra benefits. Then you come to folks who have Medicare, the red, white, blue card, and some level of Medicaid.
Yes.
The insurance companies get paid a lot more money for them. That's the only thing that we've been able to figure out, because they offer just a whole host of benefits. So when you hear on television come take this Medicare Advantage plan. We'll give you $150 every month. We will give you free transportation. We'll give you food. What they neglect to say is it's a function of age primarily, folks turning 65 to get Medicare, primarily, and income. So you gotta be under a certain amount of income to have Medicaid to reach that dual level status, Medicare and Medicaid. Now with the two, the insurance companies really want that business, so they offer you more things to entice you to come over to them. Because with Medicare and Medicaid, you're not paying any money anyway. So they've got to give you some extra things. And it's not a bad deal at all. It's a good deal. It's going to get less next year because they have to pay more for drugs. So where they were giving away $100+ a month, now they're going to start giving away $80 at the top end, 40 in the middle. They're going to separate out people who have Medicaid from full duals to people who are, they call it SLIMB. They only have partial Medicaid. It's still a good deal. Not quite as good as it was before, but it's still a good deal. But the big thing that I really want to leave everybody here with is in the district, if your income is less than $3,935, $4,000, you can qualify for QMB, Qualified Medicare Beneficiary. Here's what you remember. If your income, what the government knows you make, what you report in taxes, if your income is more than $3,935, you can qualify for QMB, which will give you a whole host of benefits. The government will pay your Part B premium, that $195 we're paying now, you're not paying your Part B premium. Now, Medicare, Medicaid. They will give you, well, that's the first thing is taking care of Part B premium. They will basically reduce the cost of your drugs. They will give you additional benefits like food card, vision, dental, even transportation. And now transportation is almost as solid as Uber. And sometimes they'll get a little slack, you know, they'll just say, you don't even have to convince us you're using it for a doctor. You can just call us and go anywhere within 25, 30 miles. The plans are as comprehensive as a regular plan. Because one of the downsides of having Medicaid alone is a pecking order. Here's a pecking order. I go to see Dr. Jones. It's just me. I don't have insurance. Dr. Jones says my visit $500. It's just me. If I want to see Dr. Jones, I got to pay $500. That's individual. Now let's say I belong to an insurance plan. The insurance plan has met with Dr. Jones and a bunch of other doctors and said, Doc, I know you charge $500, but if you come into my network, I'm gonna send a bunch of people to you, and you're only gonna be able to, we're only gonna pay you $250. Dr. Jones is a little annoyed about that, but he wants that business from, and that no, United Healthcare, Blue Cross Blue Shield, so he goes for it. So my same visit to him now, because I have the insurance, is now $250. So there's the individual, there's there's commercial, and then there's Medicare. Now Medicare said we got 65 million people down. What you want to do? We're gonna give you $175. He's got an attitude, he can't pass up 65 million people. So he signs up. So now the $500 deal, he knows he only gets 65, he's only getting $165. But he can't pass up all that business. Then there's Medicaid. Medicaid says, Doc, we'll give you $125. Yeah. Oftentimes he'll make the decision, you know, I don't even want that business. I'm not doing it for $125. That's it. So there's a smaller group of doctors, providers, who work on the Medicaid part because it's not enough money in the game to them. And I tell everybody this, I know you love your doctors, but you gotta think about how much your doctor loves you.
They let money.
And you know, there are people, I'm not mad at them.
it's nothing personal, it's all business. It's my house paying personal.
I put a woman in a plan. She walked out of her house, tripped on a stone,
Oh.
fell down and became a paraplegic.
Oh, my
Now,
God.
her husband, in the 12 years I've known him, the husband's going to heaven. He's going to heaven quick. A doctor comes over to the house. This was last week. The doctor came in the house. The doctor's been coming to our house as part of the program every week. I put them in a different plan to save somebody. She heard the name of the plan, thought she wasn't getting paid. She packed her stuff up and split.
Oh.
Didn't provide the service. I mean, she came in the house, found out she thought she wasn't getting paid. She broke camp. So of course the guy calls me. He's all upset because he thinks his wife's not getting the service. What happened was she heard the name of the company, but the company has several different divisions, and the division she heard about it wasn't paying, but this group was paying. So we got it straightened out. She made an appointment for the next month. I thought to myself, you need to come out next week. But they went for it. But my point there is just make sure you understand that it's a relationship that's based on your interest and their interest. Because if you ain't paying,
And they
how much they like you, they'll have Nurse Ratchet out there, not let you get back to them. They don't have to be the one that had dirty their hands. So the moral of the story is, if you have a friend that makes less than $3,935 in the district, and they're paying money, they're making a mistake. They're just making a mistake. No matter what plan they have, they're telling me, well, this plan will always be here. There is no plan that will always be here. The railroad guys thought the plan was always gonna be there, till one day it wasn't. The iron workers, and I thought those iron workers in Pennsylvania were gonna lose their mind, because they got a letter saying all their benefits, retirement, health insurance, everything going in the 30th of next month.
Oh my
It was a couple
God.
of years ago, and it disappeared. I kept reading the newspaper because I knew these men was going to rise up and go nuts. They took it on the chin and kept going. If you got a friend that's in trouble financially with their health, the money they're paying for the health care, and by that I mean, they complain about it all the time. It's just a burden on them. They have options. And I want you to give me a call and go over with it. And if they don't understand, then I tell you, do a three-way call. I'll tell them and you, and then you'll break it down to them when we hang up.
All right.
But you don't have to go broke to get good health care in the DMV.
Right.
You don't have to. Yeah, those are pretty much the main topics I wanted to hit on. Now, if you live in Maryland, Virginia, if you live anywhere outside of the District of Columbia, the numbers are entirely different. They're good to you in the district.
So be thankful.
Yeah, be thankful. Because to qualify for a plan in any of the surrounding states, the most you can make is $1,800, which is literally, you guys double that and can still get full Medicaid benefits for medical. And people will get confused sometimes. They'll go to they'll go down by the big chair. They'll say they want to apply for Medicaid. They make $2,500 a month. They'll get turned down. The person that was doing work didn't really think to say, well, ma'am, do you have Medicaid? I'm sorry, do you have Medicare? Because if they realize they had Medicare, they realize, oh, that number's $3,900. You do qualify. So somebody leaves there, they've been told they don't qualify, they can go home and don't look at it anymore.
I know for a fact that, coming up, I'm scalding my feet, and coming up, they say, because I have so much pain in the bottom, I gotta go to rehab center for 12 weeks. And I get free care from the insurance company. And I'm so grateful because I couldn't afford to go if I couldn't do,
Mhm.
if they didn't pay it. And thank God for Medicaid and Medicare.
Mhm.
And the one thing that I do like about United is that all I do is call and tell them my medicine is ready. I need my medicine and they send it to me free.
Mhm.
And it's a,
The reason they do that, just so you know,
so they save money on this side.
right?
Don't,
What they found out was if they do a little bit of preventive work, if they actually help you,
Yeah,
give you a couple of dollars to get to the doctor's appointment.
yeah,
If they call you and ask you, are you taking your insulin? What they realize is over enough people, they're gonna save some fair number of hospitalizations.
yeah,
So then they themselves, yeah, we will call, we'll give you a ride, and that's not a bad thing.
it's
You're
not
actually working in your interest and their interest.
at the same time.
Yeah, which doesn't always work, but in this case it does. Any questions?
For me is, and maybe I'll talk to you offline on it, just, I've always still been very confused about the whole Medicare, Medicaid thing, and, I'm one of the people who took my insurance with me when I retired. And then this year, which I was not happy about, they began to take some kind of money from my social security because of either Medicare or Medicaid. I didn't quite understand what they was taking, but they said something I wasn't paying before I needed to pay, and that reduced how much I got overall. I'm just like not really happy. I'm like, but I've got health care. And I signed up for the Medicare, Medicaid like they told me I had to.
Well, okay, then we have a.
Yeah, we
have
did
to
that there.
Because there's something else to that story.
Yeah, this,
Yeah,
so I'm confused about the whole, what they cover, cause I show up at Kaiser and I just go for it. I don't use the little blue card at all. Not that I know of.
Yeah, we would go over it, kind of figure out,
Yeah, what's going
yeah,
on.
what's really.
And I mean, and if I need to go to a better deal, then I'm
Yeah.
prepared to go to a better deal.
Yeah, because this is the district, and
Right.
there's no shortage of qualified medical providers, yes.
Do you know what the social security benefits gonna rise up in January?
I don't know the percentage.
Oh, yeah, that's what I'm looking for.
I'm thinking it's around 2%, something like that, but I don't.
Current top,
I thought I heard 2.3, but I can't promise.
cause I do mine, so I know what I'm getting in January.
Yeah, but then now
do the math.
remember that, oh, you don't, that's right, you're gonna get yours because you're part B, they're picking up. This last thing. If you have anybody in the military, no.
My son
No.
was in the
If you
Navy.
have somebody who was in the military
Yeah,
and now is retired and has Medicare, they have a program just for them that gives them, leaves their VA benefits all year long, but gives them the ability to go to a private doctor if they want. No additional cost to them.
Okay.
okay.
No additional cost to them.
Yeah, I definitely need to talk to you.
Yeah. Yeah, I tell everybody, if you're not sure about your deal, it's worth a 15-minute conversation.
Yes.
Because you might be good, and we'll have a conversation and you'll feel better because, okay, I get it.
Right.
Yes, I had a question. 2 years ago, I tried to get on one of the TV Humana or one of the others, Medicare, but then by Advantage Plan, but I talked to them and I said, well, what happened? Because I had heard a story from another person who tried to get on there. If I get off plain Medicare, the basic, and get on that, what happens if 6 months later, for some odd reason I don't qualify? I say, what happens to me then? And my understanding was, I'm just totally out there, no Medicare.
No.
And
We're always under-med.
okay.
So I'm with a company called
Mm-hmm,
Medicare is the umbrella.
okay,
I made an agreement with Altawood, and Altawood made an agreement with Medicare to basically handle my Medicare business. So I subbed my business out to Altawood,
okay.
but I'm still under we're all under Medicare.
Mhm.
If I left Alderwood, I'm still under Medicare. My bills would now go, instead of going to Alderwood, the bills would now go to Medicare.
Back to
Yeah,
Medicare.
you don't lose Medicare at all.
Oh, okay, thank
So
you.
you can try another plan. Medicare actually did a real good job of making sure we don't lose. And the reason you can know that's true is nobody's heard stories about seniors just getting cheated by Medicare.
No, you haven't heard
No.
that.
No, I haven't.
Medicare Advantage plans are good here in the Northeast, but some parts of the country, they must have some issues. Because I read about issues, but they must be happening where there's just no competition at all.
Oh,
But, if you give a business an opportunity where they have no competition, they're gonna start cutting corners. That's just, it's the nature of business.
oh.
But because there is competition here, and I know every year it's a pain in the behind when they start sending you letters, they call you on the phone, blah, blah, blah. But it's a good thing, because every year, United Healthcare has to make sure, because they're wondering, well, what's Humana doing? What's Aetna doing? Because if they come up with a really sweet deal,
They gonna
you
come up-
don't need it.
Yeah, you gonna jump ship.
Yeah.
When,
Yeah.
when
So it makes everybody, it
comes up.
makes every one
Yeah.
of them operate with a sharp pencil.
Okay,
So although it's a kind of a hassle, the
right.
competition for your business is good.
Yeah, that's good.
And that's why I asked you the question, because I know we're getting ready to get in the window.
Oh, yeah.
And I'm like,
So with-
I want to understand, here's what I got.
Yeah.
I want to understand better about the military piece of it.
Yeah.
Because, my wife and I both have that piece of it. She uses her better than I do. I don't use mine because I really don't understand how to. So if I understand better, I probably would use better. So,
In most cases, it's worth a 20-minute conversation.
yeah.
Even if you find out where you're at is good, it's good to know I'm good.
Yeah,
Yeah, don't worry about
absolutely.
something else.
Right.
You had a question.
Yeah, sort of the same situation. I retired. I carried my plan with me from my employer. My employer then, within a year, just changed it. It said, because I had Medicare separately, I had my employer separately. Next thing I know, I'm under Medicare Advantage. That's what my employer
They
did.
made a deal.
Yeah.
Yeah. For the business, you were a good loyal employee. You came all the time. You did everything you were supposed to do.
Mhm.
Now you retired.
Mhm.
You're asking the boss to pay your health insurance if you're not here. You don't have a problem with that. No, they do. I mean, that's just honest. You pay for your children's health insurance all the time they was in the house. Now they gone 15 years. Why am I still paying your insurance? And the way they do that is either cut a deal with somebody and save some money,
Mhm.
or to raise your premiums enough to the point where you will just say, I'm going away.
Mhm.
Mhm.
Yeah, because
Yeah.
at first I didn't even understand what happened, and I was like, well, wait a minute, what is Medicare Advantage? How did I get here? Yeah, and I had no
They-
choice.
More
But,
than likely, you didn't lose any benefits.
no, I did not.
Yeah.
But my question was, should I go and get it? But I didn't, that means that I would relinquish my employer's portion and go and just do the
It's a bad
Medicare.
issue.
Mhm.
So let's say we talk on the phone.
Mhm.
I will tell you, okay, before we talk on the phone,
Mhm.
find out how much you're taking out of your pension check.
Mhm. Mhm.
So we know what that number is.
Mhm.
And then it's a math issue.
Mhm. Okay.
So I talked to a guy the other day, him and his wife. It's costing him $200 every pay period to cover him and the wife.
Mhm.
But they've got a huge deductible, so it's $400.
Ooh.
But they don't have Part B because they got the job.
Mhm.
Part B is gonna be $200 each for them.
Mhm.
I said, okay, but you have no deductible. That $5,000 deductible you won't have that.
Mhm. Mhm.
And you get some other person benefits.
Right.
Okay.
Moral of the story is, it's a math problem once you have Medicare.
Mhm. Mhm.
So you find out how much you're paying, and I say based on that number, you're good,
Mhm.
you're okay. or you're not good.
Mhm.
And then you make a decision about, okay, let me see what I think about that.
Mhm.
But if somebody's complaining about money they pay every month,
Mhm.
then we wanna cut that down.
I wanna get Wallace, he's online. Wallace, you got a question?
I do. I still work at GW Hospital, and so I still have Blue Cross Blue Shield as my primary carrier. I turned 65 in December. I'm supposed to, in the next month, go ahead and inform Medicare that I am working. Isn't that correct? But who would help me do that? Do I just go online and say, hello, type in Medicare, I don't receive you, I am working, and I have Blue Cross Blue Shield?
Sometimes Medicare knows we turn 65, and they send us, they contact us. In your case, it doesn't sound like that, so you have 7 months around your birthday month. 3 months before, the month of, 3 months after, to sign up for at least Part A.
Mhm.
And that's a good thing, because Part A doesn't cost you any money.
Okay.
Now, say if we were talking, I would ask you how much your insurance costs your pay period.
But
If it costs,
With Blue Cross Blue Shield, I do pay, I think it's a $500 deductible. But once that deductible is paid,
you're done.
all that stuff that I have to do, I just walk in and walk out.
How much are they charging you a month? How much are they taking out of your pay?
Then I have to calculate it.
Okay, calculate that. If the number's below 200 a month, then you stay there. If the number's above $200 a month, then you give me a call so you can know your choices. Does that make
So
sense?
but I can still get. So you're saying I can still get Medicare and still work at GW?
Oh, yeah. Yeah, you want to get Medicare. You do want to get Medicare A.
A.
Yes, you do want to do that.
Okay.
Then, based on the amount of money you're paying for your health care at the job, you at least want to look at your options.
Okay. Because I would still need something to pay that 20%, correct?
Yes, yes. And which you have now. You got the job, you have the job insurance, and you'll have Part A. So you're going to be covered. Healthcare is a math issue for you because
Yeah.
now you're going to have good coverage. Either way you go, you want to figure out what's the least expensive thing I can do to have good coverage.
Mhm.
Correct.
Yeah.
So that would be the conversation. If you tell me they're taking $215 out of my pay every month and it's just for me, well, at $400, I'm going to tell you, hold up, we got a better way for you to get it.
Mhm.
Then on the other hand, if you tell me, well, Greg, they're only taking out $50 every pay period. Well, that's $100 a month. Stay right where you are. But you almost want to know that so you can say, okay, I'm making a smart decision.
Right.
So
Okay.
when I go to Medicare and apply online, they'll send me a Medicare card January 1st.
Well, no, actually, when did you turn 65?
December 3rd.
September, October.
Okay, they'll send you, if you did it tomorrow, they'll send you a card within a week or two with an effective date of December 1, because your birthday is in December.
It's your birth month.
Right.
Okay. So I'll go ahead and apply.
Yeah, yeah, definitely apply for A.
Yeah.
And you ask Dale for my number in case, because you will have some other questions, and it's worth the phone conversation.
Thank you.
Thank you. Yes.
Yes, one more question. I recall that you said something about military, they have a special one.
Yes.
But does this refer to military retirees only or anyone who has served time in the military?
Anyone who served time in the military and has Medicare
Oh, okay. Okay.
is particularly interesting to people who use the VA.
Right.
So somebody uses the VA,
Okay.
but their wife says, well, I got Dr. Johnson around the corner. I sure wish you could see Dr. Johnson to get a second opinion.
Mhm.
VA said you need an operation on your foot. You want to have a second opinion, maybe. This plan will allow you to go, at your charge, you go see the guy, and it doesn't matter if you only use it once a year,
Yeah,
because it's just another layer of protection on top of your VA benefit. So if somebody is a veteran, uses VA and has Medicare, they can pick up some additional insurance, some additional benefits at no out-of-pocket cost to them.
thank you.
Any other
Just
questions?
remember my name and number.
Got it right
Because-
here.
You're only gonna remember a small fraction of this. You know, I used to tell my boys all the time, you send us to school to do this. You think, well, how much do you think I'm gonna teach somebody in 20 minutes?
Don't worry, that's why I said I'll give you a call, we have a conversation, cause I got a couple of wickets. I'm still very confused by it all.
I tell everybody, give me a call.
Just like my son, he was in the Navy and he's retired and he works civilian and pay tax and everything. But I come here for me and him because I need to ask questions to protect him. He used a hospital, he lives in Hampton, he used a hospital in Hampton. He, but I don't know what else he could get or whatever, and I need to
Yeah,
find.
there are things you can get, and the three of us get on the same phone call, and you can hear what he's told to help.
You don't know who you're talking to, sir. I can't dial the phone.
Just give him, get the phone, he's got a card in there, give him Greg's number.
It's
That's it, he can help you out.
No, I understand. And I tell people, one of the reasons you wanna have somebody is because you get these phone calls and you get some stranger and you sign up with them. Now it's 3 months later, you have a question, you're never gonna find that person again. Now you got some new person.
That's doing the same thing. Because people call our house all the time.
Which you're not supposed to do.
And then when they say, and the next thing they say, how old are you? And if you tell them their age, which I don't care because I'm 18. They hang up on you.
Oh, well, it depends on what they were trying to sell.
Yeah. Bull.
Yeah, no, I don't do no.
Nobody is supposed to call you about Medicare unsolicited. Nobody.
Good to know.
Get over it.
I don't know, they get away with it, they just get away with it. They dial from out of the country, there's nothing anybody can do to them legally, but nobody is supposed to call you unsolicited.
I'll keep that in mind.
Yeah. Are we good?
Yeah.
Yes, thank
Thank you for the
Thank
opportunity.
you.
Thank you. You have my number, you have any questions?
Yeah, I
Somebody
got
wants to sign up, I do gift certificates, so if you got a friend, call me, tell me who they are,
Okay.
have them give me a call, tell them to tell me, and
Okay.
I'll make sure I get a gift certificate to you.
All right.
Can I sign up now?
Yes, ma'am.
Well, thank you, Greg, I appreciate it, thank you everybody for coming and your support.
Thank you.